Good morning. The Committee on Health and Human Services will come to order, and it's Tuesday, February 14th, and we do 2023, and we do have a quorum present. We have two bills on the agenda. We will begin with Senate File 3. Senator Boldon is ready to present. And I believe you have an amendment for today. This is not the first step for this bill, of course, so I don't know if we have the amendment passed out yet. It's coming? Okay. So if you want to proceed and talk about the amendment and how you're planning to incorporate this into the bill, and you can proceed with that.
Thank you, Madam Chair and committee members. If it's okay, I will just briefly talk about the bill first, and then we'll introduce my amendment.
Sure, that's fine. Yeah,
very good.
please
Thank you.
Proceed.
So again, thank you, Madam Chair and committee members. I'm grateful to be here this morning to present Senate File 3. This is a comprehensive democracy bill that defends, strengthens, and modernizes Minnesota's best traditions of voter participation, sound election administration, and trusted local elections officials, transparency in government, and grassroots campaigns with voter and local donor support. This package of common sense solutions rests on the premise that our state works best when Minnesotans' voices are at the center of our democracy. All Minnesotans benefit: Black, brown, Indigenous, white, Metro, Greater Minnesota, rich, poor, Democrats, Republicans, independent, and those with no party at all. We all benefit when Minnesota voters, not corporations or national forces, are at the center of our democratic process. So this is a big bill. However, the jurisdiction for this committee is relatively narrow, but I'll just mention some of the pieces of the package of this bill. It includes protections for voters and election officials, pre-registration for 16 and 17-year-olds, provisions to restore the vote for those who have been convicted of a felony and are no longer incarcerated, provisions to preclude foreign invested corporations from spending money in our Minnesota elections. It includes provisions for increased language supports for folks who speak languages other than English. It includes provisions for a permanent absentee voter list, and it includes a provision for secure automatic voter registration, and that's where we're going to spend the time in this committee. And so with that, I would like to move, Madam Chair, the A47 amendment.
Thank you. Let's see. So that's the one that was just passed out. Do you want to tell us about this amendment and how it fits into your bill?
Thank you, Madam Chair. So I'll talk to first just a little bit about secure automatic voter registration. And so it's a bit of a misnomer because it is not automatic. It is seamless for the voter, but it is not automatic in the background. All the checks and the work behind the scenes continue to happen. But essentially what automatic voter registration does and says is that when folks interact with agencies like DPS or DHS, and they are providing, through the course of that interaction, they're providing the necessary information that is needed for voter registration, then behind the scenes they are registered to vote or their voter registration is updated. And so in working with DHS on the language, that brings us to the amendment. And so what the amendment clarifies is that data will only be transferred for applicants who are 18 years of age or older. So essentially the pre-registration components of this bill for 16 and 17-year-olds don't apply for the AVR piece with DHS. So we're only talking about those 18 or older. Data will only be transferred for applicants, not everyone who is listed on the application. So if other family members aren't the goal and the target of the voter registration. It's just the applicant themselves. None of the agencies need to change their existing applications. What they currently have is sufficient and useful to get the information needed to do the voter registration. Federal authority is required before moving forward with this, and so the language says that, this won't take effect until after that federal authority is granted, and then a year after that in order for them to get things in place. It says that DHS can continue their primary method of verifying citizenship for Minnesota Care and medical assistance, that they don't need to change that process because, as we know, you need to be a U.S. citizen to vote, and they're gathering that information. They can continue to use their current processes to do that. And then, as I said, after the federal approval is granted, then it won't take effect for a year. So that's essentially what the amendment says. And again, just the gist of this is to have a more seamless process and bring more Minnesotans into the process to have them register to vote and have that updated. There is, after that happens, they will receive a postcard in the mail saying, you've been registered to vote. If they would like to opt out at that time, they are welcome to do so. And anyone is welcome to opt out at any time if they would like to unregister to vote. But it does make a more seamless process for the voter. So with that, Madam Chair, I'm happy to take questions. Apologies, and we do have a couple of testifiers as well. Thank you.
Right. What's that? Senator Abler?
You can go there and then.
Okay. Senator Utke?
Thank you, Madam Chair. And to the amendment, this has things in it that I believe are outside our committee's jurisdiction here this morning. So, and I've just looked up here quick. It's been to this bill's been in transportation. It's been to elections. Does it need to back up to any of those because of this amendment? Because we're coming into things with the driver's licenses, et cetera, or I don't know what its future stops are. Will it be going to Commerce or some of those places where this can be weighed in by the appropriate committees?
Senator Boldon?
Thank you, Madam Chair. Thank you, Senator, for the question. There are a few other technical pieces in the amendment as well that conforms with the House language. We are trying to stay relatively on track. It doesn't necessarily change the substance of the bill, but there was a bit of wording differences in some of the amendments we've had in both bodies. After, we do have a few more stops with this bill where certainly the conversations will continue. Our next stop after this committee, I believe, is judiciary.
Senator Utke?
Thank you, Madam Chair. And that kind of answers my question. They can shake out what's, the various pieces of this because, again, it's going beyond what is directed to our committee here today. So I just wanted to make sure that a committee has a chance to discuss this and actually approve it. That's got the jurisdiction for it.
Okay. Thank you. Senator Abler?
Well, thanks. And to the amendment, could you comment how DHS does verify citizenship, Senator, or the department?
Senator Boldon?
Thank you. Sorry, Madam Chair. I can speak briefly to it, and we do have someone from DHS here as well who can go into more detail with that. But our conversation with them was around, do folks need to provide a physical paper documentation of citizenship, or can DHS use their current process, which is that they use an electronic system to verify citizenship? And so through conversations with them, we verified that they can continue to use that electronic verification that they are currently doing versus having people to provide a physical paper form. But again, just to reiterate, this bill does not change the qualifications for voting. Folks have to be a U.S. citizen to vote. This bill does not change that. And DHS will continue to use the process that they currently use with that electronic verification.
Thanks.
Senator Abler?
Sure. So, because it's referenced in the amendment, that's why I'm asking now and not later. So the DHS references a list of some sort that's a bona fide citizen list compared to an attestation by the person. Is that correct?
Senator Boldon?
Thank you, Madam Chair. Yes, Senator Abler, yes, they do verify citizenship. It's not just an attestation. They do verify via electronic means citizenship.
Senator Abler?
And just my last question to this amendment, just because the other body thinks of something doesn't mean we have to do it. We are a distinctly separate body. In many cases, we think we have better ideas than they do. And so just as at the end, in this amendment that we're voting on, which is quite an expansion of who can sue somebody or file a claim, on the amendment on line 2.29, it changes from an election official, which is actually a relatively small subset of somebody who's actually schooled in this business about what an offense might be, to any person injured by an act. And then in the next page, 3.1 and 3.2, it becomes any person. And so that is a huge expansion of who could cause a stir. And I don't even feel confident to vote on that, not knowing what the impact is. And so you brought it to us. Can you tell me what the impact of that is? And it'll be discussed in judiciary, thank goodness. But this is the wrong place for this amendment, it seems to me. But go ahead, I'll listen.
Senator Boldon?
Thank you, Madam Chair, and thank you, Senator Abler. I will say, particular to this section, it actually doesn't change the intent of the bill. The intent and what this is doing is it is the person who can bring a complaint, if you will, or take action is an injured party. This is a piece that is technical wording to align with the wording in the House. Both bodies are having the same intent, trying to do the same thing. It is the injured party that can bring an action forward. We just worded it a little bit differently in each body, and so we are trying to align the language.
Senator Abler?
I wish you would have not given me that explanation. Like, we're just conforming to the House and an injured party. This is a huge expansion. An election, there's how many election officials at any particular place they go to training and they know what the rules are. This allows somebody who thinks they were injured to file a claim up to $1,000 per offense and could severely clunk up the system with charges that aren't even bona fide, where they felt that they were somehow aggrieved. So if it would, I'm actually going to move to divide the amendment and just to vote on this separately, because I don't think this belongs in our committee. I think you should take this amendment to judiciary, explain why it's so important, let them decide. Otherwise, it's in the bill, and it's just going to be conforming to the House. And I didn't wake up this morning to cause trouble with your bill, although I wish in the past election bills have been bipartisan. This bill is moving in a way that is not at all bipartisan. It's moving into a one-sided thing, and it's not good for the industry. It's not good for Minnesota. The give and take on bills like this has been amazing historically, and just because you have the votes to pass something in whatever committee you want to do it doesn't mean it's a good idea. So, Madam Chair, maybe staff can give me advice about where to divide it, and then I will stop talking about this amendment.
Thank you. I guess request to council, I'm not sure where the
Maybe between
the
2.27 and 2.28.
Madam Chair.
Senator Boldon.
I would just note, this wording is a technical change to fix a drafting error. It doesn't actually change the substance of the bill. So I would just offer that.
So I think, Madam Chair, between when you get to the page, so maybe between 2.27 and 2.28 probably is where the topic changes. So, and you can take the first part first, and then I'll just offer a comment to the second, and then we'll vote, and I'll probably lose. But I'm trying to make a difference in this. I'm trying to make this actually work, and I don't think it's at all technical. So, Madam Chair, thank you.
Advice from council, I guess, in terms of where to make the division, is that, or can you state the motion, I guess, that if we want to move, or if Senator Abler wishes to move the first part of the amendment, can you state what the motion is?
Madam Chair, committee members, the motion is to move page 1, line 1, through page 2, line 27.
On that motion, is there further discussion? All those in support signify by saying aye, or of the of moving from 1.1 through 2.27, please signify by saying aye. Aye. Any opposed? The divided amendment is adopted.
Thanks, and Madam Chair. If I could
Senator
request of the
Abler?
author, just withdraw this part for now and take it to judiciary. Tell them why you think it's technical. I don't know how on earth we have the staff here or the capacity to decide the actual correctness of your statement, but I cannot imagine how, if we take out the word election official and replace it with any person, that's not a huge expansion, and just because the House did it, the other body, Madam Chair, is not the reason that this committee should take it. We were cautioned sternly to focus on this little bit of the thing related to DHS, so I think it would be just a good process, Senator Boldon, if you would just withdraw it and then take it up in judiciary. They'll certainly be happy to do it there. Thank you, Madam Chair.
Senator Boldon, any response?
Thank you, Madam Chair, and I appreciate the discussion. I, again, would just reiterate that it is a technical change. It does not change the substance of the bill. It is just fixing a drafting error, so I will continue to offer the amendment.
And I kind of see your point, Senator Abler. I do think that it can be discussed in judiciary if people have concerns. I would like to move forward with the second part. And Senator Edke.
Thank you, Madam Chair. I would like to ask council, I mean, to me, like Senator Abler is saying, to me, it looks like this is a huge change. Can you explain to us why this would be considered a drafting error?
Ms. Hoffman-Lucci.
Madam Chair, Senator Utke, from my understanding, it was holdover language from a previous bill, and this puts the bill language in the form that it was intended by the author.
Senator Edke.
Okay, well, thank you. That takes it from drafting error to author's preference, which is totally different. I guess in my mind, it's again, as Senator Abler has said, it appears that they're following the other body, and that's not what we do here. We do what comes before us. So, but that helps tell me where it comes from. Doesn't help the issue. I still think it's really bad, but thank you.
Oh, I'm sorry. Senator Liskey.
Madam Chair, I would like to ask the author, we have on line 2.20 in the amendment, if permitted by the federal government, that does change the bill. That changes how the bill works. We are now including federal government into the decision-making of this equation. So we are changing the bill here. That's what the purpose of this amendment would be. And so we just said that it's just conforming, but it is changing the bill. So are we voting on an amendment that we're in jurisdiction or we're not? I mean, that's what our committee is here to talk about. So
I think I'll just make a little clarification. You can, Senator Boldon, add to it. That part is within our jurisdiction, the change, the addition of the language about if permitted by the federal government, and that has to do with this form that if we want to move forward with having the medical assistance registration process, we have to get permission from the federal government, and that isn't in the current language correctly. You know, it's not stated correctly. So the amendment is pertinent to our committee in that respect, and that is part of it. I think what Senator Boldon is indicating, that as bills move forward, we find things that need to be corrected or conformed, and it includes some of that as well. But she's saying that it doesn't change the substance of the bill. So does that answer your question, or do you want?
I mean, it does, but like I said, then if this section is changing the substance of the bill to conform with like the federal government, then how do we know that the rest of the amendment is not? So that's something that we can't comment on here. So that's I think why Senator Abler is working so hard to split and make sure we amend the part that we can amend here.
And I'll just go back to Senator Boldon, if you could comment on that.
Yes, Madam Chair. When I was speaking to saying that it doesn't change the substance or intent of the bill. I was speaking to the final section. As you mentioned, the line about the federal government, I'll just note that there is other language about approval from the federal government in the bill on line 7.15. This phrase is just clarifying that it applies to both DHS programs.
Thank you. Are there any other questions? Senator Abler.
Madam Chair, just briefly, we're going to vote, and I mean, the way it's going, we just have to sit here and succumb to whatever. You're a very careful legislator and a really good chair, and this kind of amendment's just not in keeping with that, and it really doesn't belong here. Our staff can't even tell us what it does because they're not election council, and they're very good at DHS and MDH stuff. So whatever, I've made my point, and I just wish the Senate works the best when we work together. It works the worst when one side does whatever it feels like, and even in the wrong committee. So I'm a collaborator. I want to try to find an election bill I could vote for. And if they would have worked with me, I might have talked to them about some things that I had concerns about in the bill. And other people on our side have great concerns about some of this, all of which are being left behind, including voting on amendments that don't even belong in the committee. So I'll stop. Thank you, Madam Chair.
All right. So noted, Senator Abler. I do feel that my observations of the bill's path to this point have indicated that the author has worked with all those who have brought questions. So I would say that still is a possibility. And if you do have questions or concerns, that I would encourage you to work with the author on that. So we'll take a vote on the second part of the amendment. That's lines 2.28 through line 3.5. Is everybody clear on what we're voting on? And all those in favor of this portion of the divided amendment, please signify by saying aye. Aye.
Aye.
Any opposed?
Respectfully,
No.
The motion does pass, and the second portion of the divided amendment is adopted. And council, please correct me if I've left out any parts of, okay. And now that we've adopted that amendment, Senator Boldon, do you have any other comments right now, or do you want to move to your testifiers, and then we can go back to other questions that committee members have?
Can I just ask a clarifying question, Madam Chair? We've adopted the second part of the amendment. Have we adopted the first portion of the divided amendment?
Yes, we did.
Thank you. I would just have a couple of comments, I guess. I'm very open to continuing conversations with any members about this bill, and happy to do so and welcome that. I will also just note this is a bipartisan bill. In elections, we did take an amendment from across the aisle, and so grateful for that. And again, I'm happy to continue those conversations. Thank you.
Thank you. And I will move forward with your testifiers. The first testifier we have today is coming to us on the Zoom link. Her name is Teresa Dolata. Teresa, if you could introduce yourself for the record and please provide your testimony.
I'm Teresa Dolata, and I've lived in Minnesota for over 20 years. I am disabled, and it is hard for me to get there today and testify in person. So I'm grateful to be able to testify virtually. One of my main issues around voting is that my polling place isn't easily accessible by public transportation, so I choose to do mail-in ballot. However, I live alone and need a witness that is registered Minnesota voter to witness, so that makes it difficult for me to participate. Over my 20 years living here, I've lived in many districts. It was hard to know where my voting place was. I was not automatically registered. The times I was coming out of homelessness was even harder. I know there were times I missed out on voting because of this. Luckily, some of those times I had people help me find out how to register, but not everyone has access to a laptop to look up voting resources or even know where to look. It also isn't the easiest to make that change. The last couple of times I voted, I had to take my ballot to church on Sunday to find a friend to witness my voting for my ballot. Also, the early voting centers for my city, Minneapolis, is up in Northeast, and even though it is on the bus line, it takes me 2 buses to get there. Then the distance from where the bus stop is and where the early voting center is in the office complex is too far for me to walk due to my asthma and arthritis. I worry about if I ever have to move again. If my polling place isn't accessible, then same-day registration doesn't do much good for me. We need more early voting centers and more accessibility for people like me to do voting at our polls early and at our polling places. But we definitely need automatic voter registration to make the process as simple and accessible as possible for all Minnesotans who are eligible to vote, especially our younger voters and those coming out of homelessness, our disabled and elderly voters. We need to eliminate the barriers and have automatic voter registration. Thank you.
Thank you very much for your testimony, and happy that we could accommodate your testimony today. Now we have 2 in-person witnesses, Lauren Witt and Vineet Rahman. If you could please come to the table. Good morning. Welcome to the committee, and please state your name for the record and proceed with your testimony.
Hi, my name is Lauren Witt. Thank you, Chair Wicklund, for the opportunity to testify in support of SF3. I currently reside in St. Paul, Congressional District 4. I work full-time as a grant writer and program manager at Children's Dental Services, referred to as CDS, in Minneapolis. In my work, I deal with populations that face extreme limitations to bettering their health. CDS primarily serves low-income children and pregnant people, so I see the benefit that public programs provide, but know that much more can be done to promote full inclusion and improve well-being. I also serve as the advocacy chair for the Minnesota Society for Public Health Education, and am a prospective graduate student at the University of Minnesota Twin Cities. But most importantly, I'm an advocate, young adult, sister, friend, community member, and a firm believer that our health and the health of our democracy are deeply connected, and the right to vote should be easily accessible to all and expanded upon by those with the power to do so. Inclusive, robust, democratic processes are vital for creating opportunities for everyone to be healthy. Ensuring representative, democratic decision-making and holding systems of accountability in place are necessary for health equity. Research from the Health and Democracy Index found that communities with high voter participation enjoy greater social cohesion and better health. Currently, Minnesota is ranked as the 15th easiest state to cast a ballot, underscoring our commitment to inclusive democracy. However, there is room for improvement. We applaud the opportunity to improve civic and voter participation through the policies included in SF3. Including AVR within DHS would dramatically improve voter registration for low-income Minnesotans and increase opportunities for improved health and well-being. Not being registered to vote is the #1 reason for not voting. AVR would reduce the administrative burden associated with registering to vote and alleviate unnecessary barriers to inclusion. Community health and well-being would be considerably improved by the passage of SF3, and I strongly urge the Health Committee to pass this bill and the provision to enact AVR because it will empower Minnesotans to actualize a healthy future for ourselves and our communities.
Thank you very much for your testimony. And please, is there a sign-in sheet there? Okay, if you could sign in for me, I'd appreciate that. And then the other testifier that we have is Vineet Rahman. I apologize if I mispronounce your name. Welcome to the committee, and please state your name for the record and provide your testimony. Thank you.
Hello. Yes, my name is Vineet Rahman, and thank you, Chair Wicklund, and thank you, Senator Boldon, for sponsoring Senate File 3. I'm a second-year medical student at the University of Minnesota and a fellow with Advocates for Better Health, a group of physicians and medical students in the Twin Cities area. I'm also a frustrated Georgia voter. Being a Georgia voter means waiting in lines, missing registration deadlines, facing onerous voter ID restrictions, and praying your ballot reaches where it needs to go by 7 p.m. on Election Day. After I moved to Minnesota 2 years ago, I saw how, I was amazed by how inclusive and accessible voting could be, and as Senator Boldon says, this Minnesotan tradition of excellence. As a medical student, I'm learning how good medical care can protect and improve the health of individual patients. I'm also learning, though, about the limits of medical care and the importance of social, economic, and environmental factors in protecting and improving the health of entire communities. One of those factors is voter participation. Recent data demonstrates that voter participation leads to better overall health on many measures, including mental, physical health, chronic disease, premature death, and infant mortality. Given that Minnesota has one of the highest voter participation rates at 80%, it's not a coincidence in my mind that Minnesota is also one of the healthiest states in the country. For example, Minnesota's maternal mortality rate, which is often used as a proxy for healthcare quality and community health, is 8.8 per 100,000 persons, and that ranks as one of the best in the US. Meanwhile, my native Georgia, which has a voter turnout of 68%, has a maternal mortality of 28.8 per 100,000, over 3 times that of Minnesota's. When democracy is inclusive, our communities have the power to express their voices, electing representatives who will support their health and well-being. Research has shown that groups commonly targeted by restrictive voting laws, such as those with low incomes, who are racial minorities, and who are young, are also less likely to be insured in states with more voting restrictions. And so low-income folks, of course, are also more likely to be on medical assistance or Medicaid. So allowing them to vote, register to vote with a quick form or click of a button while enrolling for government assistance would take one more burden off their plates and ensuring they can vote seamlessly. And so I hope to have illustrated here that there is a vital symbiosis between democracy and health. And as a medical student, I want my future patients and community to be able to see their priorities represented in the decisions of their elected officials. The more participants in our democracy, the better it works for everyone, especially those who have been historically silenced. I strongly support this bill, and I urge you to vote it out of committee. Thank you.
Thank you very much for your testimony, and if you could sign in, that would be appreciated. That is all the testifiers that I have on my list. Okay, thank you. Members, are there other questions that you'd like to ask? Senator Abler?
Thanks, Madam Chair. I do have some questions, and they're, I think, to the right sections of the bill. It says in the bill that an agency that collects name, their address, date of birth, and citizenship verification has to do this. So DHS, obviously, we've discussed that and have some questions about that yet. So would you expect that licensing boards would have to do this? Because I think they keep quite thorough records. I imagine they do citizenship. They have a list on that. Do you know, does anybody know that?
Senator Boldon, do you?
Thank you, Madam Chair. Thank you for the question. So currently in the bill, it specifically calls out DPS and DHS. There is a provision to then look at other agencies who are collecting the information, information necessary for voter registration, and allows the governor to determine which of those agencies then should be part of this process as well.
Senator Abler?
Right, well, that's kind of a non-answer. I mean, have you talked to the licensing boards? Are they equipped for this? Because it says the governor must determine, and then based upon what he must determine, it's if they collect these 4 things. So do you have any idea how many, I mean, I appreciate where you're trying to go with this. I don't appreciate where some of these topics have just been kind of not asked. So I'm asking now, and so a licensing board people aren't here. They're up to their necks with work. The nursing board is behind getting nurse licenses out the door, we heard yesterday. And so do you have an idea how many nurses they're going to have to deal with at the license? They license like more than 100,000. Do you know how many of those they're going to have to deal with and verify that they're licensed or not? Do they have a duty to verify that they're licensed, that they're registered before they do this? Do you know that, Senator Boldon?
Senator Boldon?
Thank you, Madam Chair. So in terms of licensing boards, so I'll just go back again. The initial focus of this bill is DPS and DHS. There may be other agencies moving forward if they are collecting the necessary information, so collecting information on citizenship, et cetera. For future, those other agencies may be included in this policy, but current state, that isn't the direction.
Senator Ebler?
Well,
I think,
I woke up on the right side of bed today, but I'm just asking if you've thought this through. It says any agency. I think you would be, again, better off to say what you mean, like should be DHS, should be driver's licenses. And so it is, I don't know if the Department of Health does specific individuals, but so if there's a state agency that provides individual grants to people, I mean, do you know where it stops? Have you thought that through, Senator Boldon and the advocates for this bill?
Senator Boldon?
Thank you, Madam Chair. And respectfully, I'm not trying to be evasive. I'm trying to be clear in saying that the current focus of this bill is DPS and DHS. There will be future conversations if there are other agencies who are collecting the necessary information. So, agencies who are administering grants, I don't know in this moment if they are, for instance, collecting citizenship data. If there are other agencies who are collecting all the necessary data, including the citizenship data, there will be, future conversations about them folding into this process as well.
Madam Chair.
Senator Abler?
You were going to say something.
Oh, I was just going to say that it sounds like the future work there's work that has to be done to allow other agencies to move forward with this, and that future work hasn't been done yet, so I don't think that one could say one agency or another is going to be able to participate or not at this
Thanks.
point, right?
Well, Madam, I'm just saying
Senator
the bill
Abler.
on line 8.1 to 8.20 sets up the future, and it says must, and it has simple criteria. If you collect this information, you must do it. It doesn't provide any money to those agencies. This is a money-free bill, is that right, Senator Boldon?
Senator Boldon?
Thank you, Madam Chair. We have requested a fiscal note and have not received it yet.
Well, I'll just change gears then. But anyway,
Senator Abler?
I'm just pointing out, I've done a lot of licensing work, and I know that all the costs that come out of the licensing board don't come from the state. They come from the nurses or others, and so that's just a question. So with the DHS part, as they apply for Minnesota Care, if they would go to a county, then the county would have to do this work to apply.
Senator Abler, or Senator Boldon, excuse me.
Thank you, Madam Chair. Thank you, Senator Abler. So yes, the intent of this bill is that it includes everyone who applies, through DHS for these programs. The information that they are already collecting, we're not asking them to collect additional information. They're already collecting this information, will be transmitted to the Office of the Secretary of State and used for voter registration.
Senator Abler?
So, Madam Chair, like the MNsure navigators that work all over the place, sometimes in very low-income areas, to reach out, if you remember, we have that program. Are they going to be giving out, how do they know that this person needs to get sent in and this other person doesn't? Do you know that?
Senator Boldon?
Thank you, Madam Chair. So again, they're not collecting any additional information. It's the information that they're already collecting will be transmitted to the Office of the Secretary of State. And those folks who meet the criteria, which again is not changing, will be then registered to vote on the back end.
Madam Chair.
Senator Abler?
I'm just trying to get an answer. I had a good night's rest. I'm feeling pretty good. It's Valentine's Day, it's kind of a happy day. But how does a MNsure navigator who's been trained in a minimal level to work at a church in some neighborhood trying to, on their Saturday afternoon, sign up for MNsure thing, trying to get 100% coverage, how are they going to know to submit one person's information to the Secretary of State and not to submit another one? So they have to submit them all? I mean, they're collecting the same information about this. And so how do they know? Do they have to send them all in? It seems like they might have to, because they would have no way to know, unless they're going to have to reference the voter registration list as part of their process. Do you know that?
Senator Abler, my impression of this process is that it is transparent to those who are using the system for this other purpose, for the their design purpose, which is signing up for health insurance or signing up for the Medicaid program. And so they won't have to know something about this voter registration process because it just is included, and the work to actually make that happen happens behind the scenes. And so they don't need to make decisions about, and Senator Boldon, you can comment further.
Thank you, Madam Chair. So that is correct. So for the voter, the applicant, say if somebody who's applying for Minnesota Care, it is transparent to them. Nothing changes for them. And I think maybe, Senator Abler, what I think you're asking is that it's not an individual process for every individual navigator, so to speak, that every individual is submitting information. It's a process so that, again, no different information is collected, so that navigator, their process is not going to change from this bill. The process, the change is within DHS. DHS as an agency is then sending information to the Office of the Secretary of State. So it's not going to change anything for the applicant or that navigator.
Senator Abler.
Well, is the person who's signing up to get MNsure at the church on Saturday going to know that they're going to be offered the chance to register? If they're not registered to vote, how are they going to know that they're suddenly registered to vote? Like they get a thing in the mail, by the way, you just registered to vote. Oh, I didn't want to register to vote. I didn't want to be on jury duty or something. How would they know that they, I mean, I don't think the MNsure navigator is going to know any of this. I'm just saying you have a hole in your bill. You might want to figure out a way to address it, and trying to be helpful to your end at least in a collaborative effort here. So, Madam Chair, I just let that go, but I think you might want to ask about that.
Senator Boldon might have I think.
Thank you,
Senator
Madam
Boldon.
Chair. Yeah, yes. So the navigator, their role is not going to change. And so the individual who has applied for medical assistance, let's say, and gets securely registered to vote on the back end, they will know that that has happened because they will get a postcard in the mail, and it will say, you've been registered to vote. They will have the opportunity, if they do not wish to be registered to vote, they will have an opportunity to respond to that and say, I do not want to be registered to vote, and they will be pulled off the rolls, just as anybody who does not want to be, no longer wants to be registered can pull themselves off.
Okay, well, Madam Chair.
Senator Abler.
Some people don't want to be on jury duty, and they don't want to register to vote. They want to stay off the grid. They want to be left alone. And you might want to put a thing, you might be registered to vote. You want to opt out from, there's just some gaps here as you unload this in the front end. So do you know how many FTEs at DHS they're going to need to do this? Senator Boldon.
Senator Boldon.
Thank you, Madam Chair. Again, we've requested a fiscal note and have not yet received one.
Senator Abler.
And so, I would like to know that. And so I'm not trying to slow the committee hearing down today, but I think you've got a project that has good intentions. I think there's some holes in it. I think you really need to talk to the people who are affected by this. Have you talked to MNsure and how their navigator system is going to work, and if they're going to tell people that they are going to be registered, perhaps against their will? So that's all I got, Madam Chair. This is the kind of stuff that when you work with people and you do a bill where it's collaborative, you actually find ways to iron sharpens iron. And there's probably other holes in this bill that are not in this committee's jurisdiction. But the question I would ask DHS is, how many people do you think you're going to find in this pool of people that are signing up for Minnesota Care? And is it a small, we have 80% registered, and maybe a high percentage of this group is registered or not. So anyway, well, I'll keep talking to you, Senator Boldon. I appreciate the discussion.
All right.
I'll stop.
Any additional comments? Senator Boldon.
Thank you, Madam Chair. I'll just note that, yes, we've been in conversation with DHS about this, and that's part of the reason for the amendment, and I look forward to future conversations with you about it, Senator Abler.
Well, Madam Chair.
Senator Abler.
Was DHS planning to testify today and tell us how much they like this?
No, they're present in the room to answer questions, but they're not testifying.
Maybe they can talk to me offline and express. I understand the schedules and being a chair and trying to get stuff done. You have another big bill up. So if they could stop and chat with me, I'd appreciate it. Thanks.
All right, so noted. Any other members have questions? Senator Utke.
Thank you, Madam Chair. I've got a comment and then a few questions. And my only comment, we heard from testifiers, and I appreciate everything that they came forward and said, but I'm not interested in making it being the easiest state to vote no matter where we're coming from. I'm in favor of everybody having access to voting, but making sure that it's safe, secure, and accurate. And I think we have to keep that in mind because, and I would think those that were talking about it being easy would say the same thing. We want to make sure it's accurate, and sometimes we get a little, I see things that are a little loose already, and we want to make sure that our vote counts and that everybody does have opportunities to vote. We don't want to cut anybody short, but yet voting is the most important thing we do. And if we have to do just a little bit extra, I would ask that you do that, because making sure that, again, that it's an accurate vote is big. A couple of the questions I have, I mean, there's a lot of detail in this bill, but what number of people who are unregistered to vote are eligible to vote? Do we have any idea what that number is? And, you know, I know it comes from a lot of different ways. It might be address changes, et cetera, but just going from the unregistered to who are eligible, is that something you've worked on?
Senator Boldon?
Thank you, Madam Chair. Thank you, Senator Utke, for the question. I think what you're asking is of Minnesotans who are currently not registered to vote, what percentage of them are eligible to vote?
Yes.
I do not have that information. I know there are folks from the Secretary of State's office here. I don't know if they have that information. I'm not sure. I'm not quite sure how we would know that information.
And I know there is someone here, but who's? Oh. We have one, is he from the Secretary of State's office? Oh, he just might be. Is there someone from the Secretary of State's office here who could let us know if that's something that is information that you've thought about and could possibly address? And please state your name for the record. And do you need the question repeated, or?
No, I'm good,
Okay,
thanks.
go ahead. You can go ahead.
Thank you, Chair, and Senator Utke. Nicole Freeman, Office of Secretary of State. I think that an estimate of that data is likely available. I don't know it off the top of my head, but I'm happy to follow up after this meeting today and get you that information.
Senator Utke?
Thank you, Madam Chair, and thank you, because I know that you wouldn't have an exact number right down to the last person, because again, we don't know what it is, but you've got to have numbers back at the office that you estimate, and so yeah, if you could follow up with that to all of us, that'd be appreciated. And
Senator
Madam Chair,
Utke?
I'll go on next. And a comment, and I heard the fact that you have ordered a fiscal note, because as I read this, I see things in there that I would imagine are going to come up with fiscal cost and FTEs, because we're asking the Department of Human Services to transmit this information daily. They're going to need to, they're going to want to see some extra pay and have some extra money, and also probably extra people to do that. And then at the same time, we're asking the county auditors to do the same. And so I would ask that you also, with this fiscal note, look at the local impact, because we all hear from our counties that what do we do in St. Paul, but we pass more of the workload their way with no additional funding to follow. And that's another thing that's going to be a big deal. As we're talking about these transmissions, you know, it's coming in what we're looking at today. It's those that sign up for Minnesota Care and those that are signing up under medical assistance that are going to be automatically enrolled or applied. And it was everybody's information's going up unless there gets to be a point where there's an opt-out. But year after year, when they go through this enrollment process and this information comes up, my first concern is how do we know that that system is going to purge? You know, the new information comes in, it kicks the old information out so that, you know, person X doesn't all of a sudden have 3 or 4 entries in there, and it, out in our rural areas, we have a lot of mail-in ballots that all of a sudden we aren't dispersing or sending out multiple mail-in ballots. And then as along the same line as that person fills it out and maybe there's a change of address, whatever in that change would kick out, you know, well, okay, we need to update them. It's getting the old stuff out. And how do we know that that's right? I mean, which address is really correct? The one on their voter registration, or did they, you know, did it really change? Because some people, it's been mentioned earlier, and we all know some that don't want some of these things to be recorded. And if they put down the wrong address or changed it a number, how are we going to verify those things? Is there a system in place so that when there's changes that come through, that we actually have follow-up to know what is the correct information?
Senator Boldon.
Thank you, Madam Chair. Thank you, Senator Utke, for the question. So, as I said, the name is automatic voter registration, but, you know, on the back end, it isn't automatic. It continues through the process through the Office of the Secretary of State that has many checks to be sure that the information is accurate. To your other question about, you know, if there are changes, I would say, you know, again, there are checks and processes currently within the system for that. So when new information comes into the system, you know, it's the most recent information that is used in the system. And the other thing I would say about, you know, potentially, you know, people wanting to be off the grid, these are people who are interacting with the government. They are interacting, they are applying for medical assistance or, you know, some other aspect of you know, an interaction with the agency. So they are coming forward to doing that, and we're not asking for any additional information. This is the same information that they would be providing through that process, you know, anyway.
Senator Utke.
Thank you. That's all.
Okay. Senator Morrison.
Thank you, Madam Chair. Senator Boldon, thank you very much for carrying this just incredibly important bill. You know, in the face of voter suppression efforts across the country and disinformation campaigns, I'm just really proud that here in Minnesota, we're protecting our democracy and every eligible person's right to vote. This is a very important bill. I'm grateful to you for your efforts, and I also want to congratulate you and thank you for your grace and equanimity this morning.
Senator Abler.
I wasn't even going to go there, but Madam Chair, there's no voter suppression in Minnesota. We have same-day registration. You can vouch. We have voter drives. It's easy to vote in Minnesota. The doctors said that he liked it way better than Georgia, and this isn't Georgia. But anyway, so I appreciate the intent that you're trying to get to include more people. Just the question I was going to ask, Madam Chair, is this bill going to go to state government then too?
Senator Boldon.
Thank you, Madam Chair. I believe, yes, that is on our path currently.
Very nice. Thank you.
Okay. Senator Hoffman.
Thank you, Madam Chair. Two questions, and maybe Heidi, I think, from the Secretary of State's office. There's, thank you for doing this, Senator Boldon. There's a couple of things I don't see in here. Number one is the accessibility piece. If somebody needs some alternative ways in how they get registered, that would be accessible in compliance with certain sections of law that I'm not going to quote, but I will if you want me to. And then the second one is, well, it's 504 of the Rehab Act, and then it's Title II of the ADA. The other one is the ERIC system. Is that still in play? Is that so that anomalizes, so your data is really protected? I mean, that ERIC system that we put in the state of Minnesota is absolutely first class. When it's I can't even say the word, but but that's still in play here. And so there's data protection in place, but it really is about, I didn't see anything about really the alternative forms of accessibility for people that need to register. How are they going to balance that?
Senator Boldon.
Thank you, Madam Chair. Thank you, Senator Hoffman, for the question. I'm happy to have continued conversations with you if you, feel there are additional pieces we should add. I would say I think this process does help with that accessibility piece, as we heard a testifier for that very issue, that this allows a way to keep that information updated and registration updated without having to make another trip out to do so. I also will just note that this process, as has been done in other states, significantly decreases the same-day voter registration because people it has already been done. It has kept up to date previously. And so I think that too helps with the accessibility piece. But, if there are other measures that we can put in place to help with that, I'm happy to have continued conversations about that.
Senator Hoffman? No? Senator Liskey?
Thank you, Madam Chair. Madam Chair, I have a couple questions for Senator Boldon. The first one would be, what happens if an applicant moves after the application but then does not register that with the state? So now they're registered to vote in the state of Minnesota, but they no longer live in the state of Minnesota.
Senator Boldon?
Thank you, Madam Chair. Thank you, Senator Liskey, for the question. I would say the same thing that happens currently when somebody is registered and then moves. The process would be the same.
Sure. And then
Senator Liskey?
Thank you, Madam Chair. Madam Chair, the other question I have is, and it's something that we've kind of tried to address already, is I appreciate what Senator Morrison said, is that we're trying to increase access to voting, and I completely understand that, and the idea is that we are trying to make voting as open and transparent as we can. My number one concern here, though, is this isn't just about making it available. This is actually forcing you to register to vote, and I think that's what Senator Abler was trying to get at, is there are people out there that don't want to register to vote. And now, instead of choosing to register to vote, they're now forced to register and then apply not to be registered. So they have to actually go in reverse to basically remove themselves from that registration. Is that correct?
Senator Boldon?
Thank you, Madam Chair. So yes, this it changes it to an opt-out process. So if folks are registered and do not wish to be registered, they can absolutely request to be unregistered.
Senator Liskey? No? Okay. Members, any other questions or comments before we conclude? No, I'm not saying I want more questions. No, I want to give you the opportunity to ask questions. So, Senator Boldon, final comments about your bill?
Thank you, Madam Chair. Thank you, committee members, for hearing this bill. I'm glad that we're hearing support for making the process more accessible. I think we do want to make voting easier for folks. There are barriers for folks in Minnesota to easily casting their ballot and casting their vote, and we know that we have very secure systems here in Minnesota, and we want to continue to remove barriers as we can. So thank you.
Madam Chair.
Thank you. Senator Abler?
Just to make it clear, there's parts of this bill I really like, and some parts I think are really not helpful in the process, and so that's why I'll be voting no. It's not against some of the parts that are good, so thanks.
Thank you. Without seeing, or not seeing any other further comments, we'll move to a vote. Senator Boldon, do you have, can you make the motion on your bill?
Thank you, Madam Chair. I would move that Senate File 3 be passed as amended and re-referred to Judiciary.
Thank you. Senator Boldon moves that Senate File 3 as amended be recommended to pass and be re-referred to the Committee on Judiciary and Public Safety. All those in favor, please signify by saying aye. Aye. Any opposed? No. The ayes prevail and the bill is passed. The motion prevails. Senate File 3 as amended is recommended to pass and is referred to the Committee on Judiciary and Public Safety.
Thank you, Madam Chair.
Thank you, Senator Boldon. And now we will move to Senate File 287. Senator Murphy is here. And we just have the one in-person testifier. Welcome to the committee, Senator Murphy.
Thank you, Madam Chair.
And please proceed with your presentation of your bill.
Thank you, Madam Chair. Would you like to move the bill?
We don't have to.
All right.
The bill is in front of us.
Thank
so.
you, Madam Chair. I am grateful to be here before you and this committee today to talk with you about Senate File 287.
Can you pull the microphone or be just a little closer?
I will
Thank
scooch
you.
up my chair.
All right.
How's that?
That's great. Thank you.
Senate File 287 is known as the Protect Access to Contraception Act. This proposal will ensure that Minnesotans can plan their families and their futures by accessing the birth control that is right for them, regardless of the cost, regardless of unnecessary insurance barriers, and without political interference. This bill puts in state law what is already federal law. 29 states have already taken similar action. This bill does three things. It guarantees that contraception and contraceptives are covered by insurance without copays. It ensures that medically necessary contraception is covered without political interference, and it allows Minnesotans 12 months of birth control at one time. So you only have to go to the pharmacy once a year, which is a good thing. This proposal is about our health. It's about our health care. It's about our economic well-being. It's about our self-determination. 9 out of 10 women use birth control in their lifetime. And by ensuring that it is affordable, uninterrupted, and accessible, we are supporting the health and well-being of Minnesotans and their families. And I ask for your support. And I have with me Dr. Erin Stevens, who is a provider, and she'd like to testify.
Thank you. Thank you, Dr. Stevens. Welcome to the committee. Please state your name for the record and begin your testimony.
Thank you, Madam Chair and members of the committee. My name is Dr. Erin Stevens. I'm an OBGYN physician and a member of the American College of Obstetricians and Gynecologists, otherwise known as ACOG. I'm here today representing Minnesota ACOG in strong support of Senate File 287. I spoke on behalf of ACOG on this bill in the House 4 years ago, and at the time it seemed like a no-brainer, and yet here we are. If anything, as a country, we've moved backward when it comes to reproductive health, but I am hopeful in the state of Minnesota that we are moving in the right direction and that once and for all, we can enact this important legislation. Investment in contraception is an investment in the future. I do mean that in a literal sense, knowing that the United States and each individual state spends billions of dollars annually total on unintended pregnancies and its consequences. I also mean it in a broader sense, that ensuring contraceptive access helps people to plan healthy pregnancies at times that are right for them, that are spaced appropriately, so that they can have children that are best supported in all ways, so that we can have positive and healthy, loving family relationships and have thriving communities. Pregnancies is the biggest medical risk that most people with a uterus will take on in their lifetime. We know that new medical problems may arise, existing medical problems may worsen, that can happen during pregnancy and postpartum, and that can last a lifetime. The United States is the only high-income country with a rising rate of maternal mortality, and among those countries, we have the highest rate. Personally, having experienced a postpartum hemorrhage after the birth of my daughter, who is here today by necessity, and that's why I'm covered in spit up, after experiencing that, I know that if I were to have a subsequent pregnancy, I would be at a higher risk of having another life-threatening postpartum hemorrhage. And I cannot imagine taking on that risk and leaving my baby and her older sister without their mother. Historically, birth control pills have cost people hundreds of dollars each year, and intrauterine contraceptive devices can cost upwards of $1,000 upfront, simply cost prohibitive for many people. Limiting the ability to access 1 to 3 months supply of contraception at a time for some methods makes continued consistent use a logistic impracticality for many people. In the immediate years following the passage of the Affordable Care Act, with some of the protections to contraceptive access that provided, there was an 18% reduction in the unintended pregnancy rate across the country, as well as a 10% reduction in the abortion rate. Contraception is important preventative health care, and we need to prioritize it as such. Let's move forward as Minnesotans and support Senate File 287. Thank you.
Thank you very much for your testimony. Do you have any other testifiers? That's all? Okay.
I think she said it all, Madam Chair.
Thank you. Any other comments before we go to member questions?
Madam Chair, and thank you, Dr. Stevens. I can't wait to meet that baby. This is a proposal that has been in the works for many, many years, following the passage of the Affordable Care Act. Much of the consternation after the passage of the Affordable Care Act has now been remedied. And we have now the ability, with 28 states, 29 states ahead of us, the ability to put this into state law to make sure that people have access to this necessary medicine that is going to support their health and their well-being. It's time. It is a place where I hope we can find common ground, bipartisan support at a time when we are debating reproductive freedom across the country. Here is a place where we can come together and support people when they're choosing to start and raise their families. Thank you very much for hearing this bill today.
Thank you. Member questions. Senator Udke.
Thank you, Madam Chair. And a question for Senator Murphy. And a couple of these things I had forgot last week when we started these bills that basically are mandates put on our insurance providers or insurance plans. But we have a process with the Commerce Department, the Commerce Mandate Review. Has this bill been given to them, which would have had to take place back in August so that they'd have a chance to give us the numbers before session? Has that happened here?
Madam Chair.
Senator Murphy.
Thank you, Madam Chair, and thank you, Senator Udke. This bill puts in place what is already in place in federal law. So it is essentially not a new mandate. We are going next to the Commerce Committee, where we will have a discussion about the duration of a prescription for 12 months. That is technically, you could consider that a new insurance mandate, but is really just extending a prescription that someone is going to get. Someone's going to take that medication for a year, and the importance of an uninterrupted contraceptive and contraceptive method is really important for the goal of this medication. And so, no, it did not go through that process because it is not a new mandate, and we will go to the Commerce Committee next.
Senator Udke.
Thank you, Madam Chair. Well, it most certainly is a mandate, because if it was being paid for today, we wouldn't need this bill. So this bill is going to mandate to our insurance companies that they're not going to collect any co-pays, no co-insurance, no deductibles. That's a mandate. And we just have to be fair and true to what we're really doing. And, you know, I think we need to know what this is costing. Last week's bill with the mammogram testing, these are all issues that we all are concerned about and support. But we have to be upfront on who's paying these costs. And if we keep loading up the insurance companies, sure, when we tell them they're going to pay for it, they will. But what do they have to do to pay for it? They have to raise premiums. We all remember what we saw back in 2015, 16, and 17 with what came from the Affordable Care Act and MNsure. The price in our individual markets went through the roof. The more we keep adding, we're going to do that same thing. So we have to have a plan that gets us to where we want to go, but yet keeps insurance affordable. Because all of a sudden, if it's not affordable and they don't buy insurance, well, where do we land then? So that's my concern. There's going to be probably more bills, and if we keep adding layers to this, we're going to break the market again. And so I would encourage, we need to know what this costs, and it's got to cost. Because we have a bill, it's got a cost. So I would hope that somebody could come back with that cost to us. So thank you.
Thank you, Senator.
Thank you, Senator Udke. We do have a fiscal note request has been submitted. It will be affected by the February forecast numbers, so we don't have that. And if obviously, if the bill, if the fiscal note we get back has information that dramatically, that I feel that we need to bring it back to the committee, we can do that. Senator Edke.
Madam Chair, for clarification, if we get a fiscal note, that's what would, I guess it would show cost to the plans that the state is covering, so it would give us kind of an idea. But the Commerce Mandate Review that I'm talking about tells us what all the plans would take on for additional cost. And that's the piece I'm looking for, is how is it affecting our market? And I guess when the fiscal note comes, I guess that'll give us a small look at it. And then we can take and kind of multiply it out. And the other thing is, none of these things that we do affect any of the ERISA plans, which is the biggest insurer out there, is the private big business who's got their own plans. They don't have to follow this. So again, we're working on smaller groups, the individual market, et cetera. So I just don't like the direction we're going, so thank you.
Senator Murphy, did you have further comments?
Thank you, Madam Chair. I just want to reiterate that by passing this law, we will be putting into state law what is already federal law.
Right. Senator Abler.
Thank you. And so I appreciate the bill. I just have a couple clarifying questions. In talking to the Catholic hospitals and so on, it appears they are not around today, but I'm asking, I thought of this all by myself, but just given the history of this topic, and it appears that this is the definition that's from the Department of Health and the ACA that has been worked out through a lot of toil. And so this codifies that very language. And so if you're a Catholic hospital or some company that for this is against their conscientiously held beliefs, they're affected the way they are yesterday. Is that right?
Senator Murphy.
Thank you, Madam Chair and Senator Abler. And my first work was in a Catholic hospital as a nurse. Yes, what you see before you reflects the toil of many to make sure that we are getting right access to affordable contraception while respecting religiously held beliefs and not penalizing employees that choose to work in facilities with closely held religious beliefs. So yes, it does protect a Catholic hospital.
And Madam Chair, that's the definition of a softball question. I knew the answer would be that, but I just wanted to get it on the record. And so nothing says Valentine's Day like a discussion of sterilization. Can you just,
Madam Chair, I don't think we're talking about sterilization, but.
Well, it's in the title of the bill. So can you just tell me, is that one of the things that can be, I didn't see the word in the bill, but it seems like it's referenced by, as one of the reproductive methods. Is that also being offered without a copay or anything? Is that right?
Madam Chair.
Senator Murphy.
Thank you, Madam Chair and Senator Abler. This is a proposal dealing with the methods that allow a person to choose when and if they have a child, and to make sure that those methods, all of them, are covered through employer-based coverage, except for, of course, what we've already described in those religiously held beliefs.
Senator Abler.
Well, Madam, I wasn't even looking for that carefully parsed answer. I just was curious. I haven't been coached on this bill. This is just, you're getting whatever I am this morning.
Well, I have faith in that. I have faith in that.
Anyway, but so, and that's current practice too, that under the ACA, that all that whole array of, we had enough discussion on the floor of, and in the previous committees about on the abortion side and what reproductive health is and what it's not. And this doesn't touch on abortion. This touches on contraception and methods related to that. And so I guess my specific question is the whole sterilization and other long-acting contraceptives, which was a bill we did a week or two ago, it is all in that mix. Is that right?
Senator Murphy.
Madam Chair and Senator Abler, the varieties of contraception, including long-acting contraception and choices that people make, are included, yes.
Yeah. And just, I'm
Senator
almost
Abler.
done. And so most health plans in Minnesota already cover this. Medical assistance already covers this. The difference is pretty much the 12-month. Is that the only real change from current law?
Senator Murphy.
Madam Chair and Senator Abler, this is putting into state law, federal law, yes. And the change or the addition to what is already in federal law, and as I said, 29 states have already taken action similar to this to make sure state law reflects federal law on this important healthcare issue. In addition to that, we are adding the idea that a prescription for contraception can last for 12 months, so that medication can be dispensed for 12 months. Yes.
Madam Chair.
Senator Abler.
Thanks for bearing with me, because I'm inclined, I respect Senator Utke's concerns, and I share them. But I'm inclined to support your bill in the same way, and so I'm trying to find areas we can agree on that produce a result that we like. And in the past, we've agreed that abortion, the consensus on abortion is that it should be rare. And so this will help that to be more rare. And so we discussed what a 14-year-old girl can do, and now but she can already do that without a copay and a fee. So anyway, I'm going to be supporting your bill today. So thank you, Madam Chair.
Madam Chair and Senator
Thank you,
Abler,
Senator
that's
Murphy.
2 days in a row for us. It's good. It's good.
Thank you. Any other members have comments or questions? Senator Morrison?
Thank you, Madam Chair, and thank you, Senator Murphy, for carrying this bill. I carried this bill for years in the other body, as you did too, I know. So I have a sense of fatigue about this conversation. I'm grateful to Dr. Stevens for returning to the Capitol again to testify on this bill. This is very important to the cost question. The cost of an unattended pregnancy far, far, far exceeds the cost of a year of contraception. This is about people's ability to make decisions about their own reproductive health care. Grateful to you for continuing this conversation, and hopefully this is the year that we can make this law in Minnesota. Thank you.
Thank you, Senator Morrison. Any other questions or comments? Senator Murphy, do you have final comments for us?
Madam Chair and members, I am grateful for your consideration, and I hope to earn your support. Thank you.
Members, seeing no other discussion, I appreciate Senator Murphy bringing the bill forward, and I appreciate that we will, I'm hope, as Senator Morrison does, that we are able to pass this bill this year and put this in place so that people do have a sense of surety that they have access to the methods that they choose to plan when and if to have children. Senator Morrison, would you make the motion, please?
Yes, Madam Chair. I move that Senate File 287 be recommended to pass and be re-referred to the Committee on Commerce and Consumer Protection.
Thank you. Members, all those in favor, please signify by saying aye. Aye. Any opposed?
No.
The motion prevails. Senate File 287 as is recommended to pass and is referred to the Committee on Commerce and Consumer Protection. And thank you, members. And seeing no other work before us today, our meeting is adjourned.